my name is Paul Glazer. I'm a spine surgeon in Boston, advocating the use of Surgilock. We've used this in spine surgeries now the past several weeks, and I believe it's going to really revolutionize how we perform the surgeries. It's a pad that is placed on the surgical field, which allows us to restrain things such as bovies, bipolars, and suctions and drills. I actually did a study once which actually showed that if the case goes over 3 hours, there's a 67% chance that something will become contaminated, meaning fall off the surgical field. And that's despite our attempts by performing, making folds in the drapes, such as creating a trough to try to restrain things. The real risk is, of course, infection. If something falls off halfway off the field, you have to make a decision whether it's still sterile. The second thing is it's time. Time involving replacing instruments that have slipped or fallen off the surgical field and are now unsterile that have to be replaced. The circulating nurse subsequently has to run around, find a new one, hook it up. In Boston, at our Harvard teaching hospital, it costs $300 a minute to sit in an operating room. The fact that we feel that this may reduce the incidence of these types of displacement of instruments may certainly reduce the cost as well as enhance the efficiency of doing surgery. I truly believe that this is going to revolutionize how all surgeons are going to organize the surgical field.
Dr. Catherine Lannon, and my background is general anesthesia with a pain fellowship and his MD Lock, which we're all very excited about. I think it's in the vanguard of medical adjuvant devices, and how I see this being applicable to anesthetic cases is for some of the larger cases, central line insertion, chronic pain procedures, fluoroscopy procedures. Our residents have shown great interest in trialing this up in the labor and delivery area, and I have to say we've been jealous looking over the drape and seeing its applications.
MD Lock Pad, it's actually pretty perfect in my eyes. It works really well, it keeps things very organized, and as far as I can see, it's very well worth the money. It helps keep things on the field, and it helps the doctor to realize that all he has to do is look down and see his instruments all lined up correctly in a row for him to pick if I'm busy doing something, which is actually a big help for me because there's lots for me to do other than hand him instruments. So this MD Lock is pretty fantastic if you ask me.
Hi, this is Paul Glazer. We're finishing up a lumbar fusion. You can see that it retains a multitude of instruments of all different shapes and configurations. In spine surgery, we have suctions, bipolars, bovies, neuromodular probes, thread cells, and clamps, and peanuts and clamps. All of these have been easily retained, and nothing has hit the deck today, which is significant improvement in terms of things wanting to move off the table, and this will increase our efficiency.